I'm surprised this week at how many patients, even patients of ours that are really educated about their dental health, still don't have a great understanding about what we're looking for when we're checking their gums. I really am amazed with our new patients coming in how many have undiagnosed and untreated periodontal disease. Periodontal disease or gum disease is a silent disease because it doesn't hurt. And so when you come in and see the hygienist, she checks for the health of the gums by measuring them. That's one way. So the measurements that we take, people will hear numbers, hopefully, like 3, 2, 3, 4, 2, 3. And what the hygienist is doing is she's measuring the gum space around each tooth before you get to the bone socket. And that number, there should be a little cuff of gums there, and that should measure about 2 to 3 millimeters. But if the bone down below the gums it has disease and is dissolving, then those numbers get bigger, and you might see numbers like 4, 5, 6, 7, 8, 9, 10, 11, 12. After 12, the tooth will probably fall out. So when we're taking those numbers, we're also looking for not just the actual number, but we're looking to see if there's any gum recession. We're also checking to see if there's any bleeding. Any of these things can be a sign of current or past gum disease. Now, why does all this matter? Well, we've taken care quite well in dentistry to help people have a low cavity rate, but in treating the gum disease, that's kind of lagged behind a little bit in general, in the general dentistry world. So what our patients are learning, and what I hope that this video will help everyone else understand, is that if you have a number that's greater than 3, or if your gums bleed in any area when the measurements are being done, or gosh, definitely if they bleed at all when you brush or do anything like flossing, that is a sign of an active infection. That would be similar to if you had a bleeding infection or cut on your actual skin. For some reason, when it's in our mouth, we're very tolerant of this bleeding, but we really shouldn't be. It is amazing how much that kind of infection can affect your overall health. They have actually discovered that the plaques that are inside the arteries around the heart that cause heart attacks, when they scrape that plaque, that debris from inside the arteries, and they look at it under a microscope, the bacteria that's in that plaque is the same bacteria that's in the plaque on our teeth. So does gum disease cause heart disease? It's definitely related. And so flossing, cleaning your teeth, and regular checkups, and definitely if there's any sign of infection, getting it taken care of immediately with active gum infection therapy with your hygienist. These are all things that you can do that will help you to live a longer, healthier, and happier life.